Hey, I'm Kristen Nishihara, the mayor of the City of Longview. Thank you so much for joining us today in our next video series on educating our residents about services available here in Longview, specifically for our homeless population, but today a little broader about community paramedics. So I want to thank for joining me with the Longview Fire Department Chief Ricky Norman and former Chief Amy Hooten, who is now our Community Health Manager. They run our community paramedic program here in Longview, and we just want to say thank you for being with us. Yeah. Let's start and talk about just what is community paramedics? Is that different than EMS that responds to your house? What does that mean exactly?
Yes, it's a little different. We respond, so everybody considers an ambulance. You have your ambulance and you have your two paramedics when you call 911. The way we're doing it is we take the lower acuity calls and we just have one community health paramedic and they're responding in a little Equinox that the city provides for us. And we're not necessarily loading the patient up and taking them straight to the ER like an ambulance would do. We sit there and talk to them and try to discern what is going on in their life that they might need 911 as much as they're due when they call us. So
yeah, a little more relationship building.
Yes, ma'am.
So
Yes, ma'am.
when I think about it, I think a little bit about like the police PAR officers, you know, how you build community and you build relationships. Is that kind of?
Yes, ma'am.
Yeah, that's
Yes, ma'am.
along the
Same
lines
thing.
of, okay.
And figuring out their needs and just advocating for them with the doctor's appointments and the hospitals if they need to meet their needs.
Yeah, that's pretty wonderful that Longview has that. And as I understand it, not every community has a community paramedic group like we do. Is that accurate?
Yes, ma'am. That's accurate. It's an up and coming thing. There's a lot of communities that have been doing it for years, and then there's some that are just now starting.
Yeah, that's really wonderful. Proud of us for having it.
Yep.
I often am guilty of referring to you guys as GLOW, and so I want to just make that distinction there since I've done it wrong in the past. What is GLOW, and how does that interact with what we're talking about today?
I'll let Ms. Hooten answer that question.
So GLOW is the collaborative of our 8 agencies, which is Christus Good Shepherd, Longview Regional, Greater Longview United Way, Community Health Corps, Special Health Resources, Wellness Point, and then under the city umbrella for GLOW, it's the community paramedics of the fire department, the post officers, and then other services like housing and other services that the city offers. It's just, so that is the GLOW collaborative.
And GLOW is Greater Longview Optimal Wellness.
Correct.
And that is its own 501c3 standalone nonprofit that has those partners that you're
That's
referencing.
correct.
Yes. However, GLOW is kind of your baby and your project. Is that fair?
Probably, yeah. We started GLOW in 2020, 2021. Right after the pandemic, we received a grant from Episcopal Health Foundation through Community Health Corps. They were actually the
Back up and tell me
original-
why you did that. What did you see in the community happening that made you go explore this avenue?
Well, COVID was one of the things. Prior to COVID, we were already seeing a need for advocacy for patients that were using 911 services as primary care. And so we were already looking at the community health paramedic model. And after COVID in the paramedic world, we really saw that advocacy as patients were staying at home and calling 911 more during that time. It kind of highlighted the contribution that we could give to the city, like the shot clinics and things like that we were able to help stand up, and it really highlighted the community service that we provide other than just responding to 911 calls.
Right. So as opposed to just, 911 dispatch, we come out when you're having an emergency and you ask us, we're preventatively going into the community, building relationships, helping people solve a problem that they have that might be a non-medical driver or other things, connecting them with resources that don't necessarily mean that they need to call 911.
Correct.
Yeah, so it's a benefit really
Yes.
To the patient that you're serving, plus on the city side, that's saving resources to respond in other emergencies, so really kind of benefiting both the individual and the community.
Yeah, we have every city has people that don't have advocates. A lot of us have family or friends that can help us out. Some people don't. And then just the difficulties of navigating insurance and things like that. Sometimes people even us, we may need someone to help us understand paperwork or what does that look like. And so we have case management in our medical facilities, in the hospitals. Most of our partners all have a case management group in their agency that helps people with that. But we found that collaborating together with all those agencies and just having resources, GLOW is a city resource that someone can call call. If they've run out of resources or they don't know who to call, we're available for them to call and just collaborate, brainstorm on problem solving.
Yeah, sorry, now back up and now tell me when GLOW started, how it's funded, all of the...
We started in 2021. We became a 501c3. Episcopal Health led us through the building of GLOW and guided us in our work plan as we built it the first year. And each agency provided a person to be on the steering committee that could represent our partners, and we come together monthly. We've been meeting monthly since that time to develop the program, and our board is made up of the CEOs of these partnering agencies. And so the steering committee comes up with operational ideas, and then we present those to the board for approval, and that's kind of how we...
funded? How are you funded?
We are funded by 4 grants. We have 2 federal grants, SAMHSA and the COSIP grant, and then we have the EHF grant, and also the Hogg Foundation grant. So 4 grants.
Yeah. And then, so the community paramedic piece that you guys are, City of Longview employees, is just one of those partners then that serves kind of the whole by bringing people together.
Yes. When we started as a group, we started GLOW, then we decided to bring the grant up under the city as the backbone, and that's how the city kind of became the lead for it, because we felt for sustainability in our community and our area that it would be better served if the city, plus the city has resources like housing and post and community paramedics that they could offer up for continuity.
Yeah. So if we move back to community paramedics, how many community paramedics does the City of Longview have, and kind of what is their daily role, I guess?
Well, there's 3 of us that are in this section. We have basically a day would be we utilize Pulsera, which is one platform that we use to communicate with the hospitals and with the partners in GLOW, and they refer to us through that, and so we see what's coming.
That's our data information
Right.
system. So if you had a new patient, you
yes,
would
ma'am.
input them into the Pulsar system, and that would share with all of the GLOW partners?
Yes, ma'am.
Got it.
That, and then we also have our special reports that our crews can do on the ambulances when they see somebody that might need something that the hospital's not providing or that the fire department can't provide that we could help them with.
Yeah, how do you get
that.
referred people? You kind of started talking about that, but how
Right.
would somebody be referred to GLOW? Or to community paramedics?
Yes, the community paramedics. So that referral system is a form that's filled out. It's HIPAA compliant that all the partners have approved, and any of the partners can sign them up. So any of the 8 that have the forms can sign them up. We can sign them up. We can also get referrals from family. We get referrals from our medics that are on the street that see the needs, PD, nonprofits.
Any of our nonprofits, they all have the consent, and if they want to consent them into the program, they have all the explanation, and they just call us once they consent.
What does an average patient look like? Like, what would that be typically? Who is that person?
There's so many different kinds,
Give me a couple of examples.
So, an elderly patient maybe that needs help navigating. We oftentimes go out on 911 to help people get in bed, or and in the evening time, they may have home health care that comes out throughout the day or a couple of times a week, and they don't know what their insurance qualifies them for. And so as maybe they have a brief period of decline and they need more services for a little bit or something like that, and they don't know how to ask for home health services. So what we see is a fire truck going out there, not even an ambulance, just the fire truck going to do lifts assists, going to help people get in bed, going to make them a sandwich even, and they'll call 911 because that's the only way they know how to get help. Yeah. And so when we identify these folks, now we can surround them with advocacy and come in and say, okay, how can we help you get these resources? In the past, only at the time of crisis did 911 talk HIPAA. With our consent form, if the patient lets us sign them up, we can sign up, and then we can contact their home health agency and explain how we're coming along the patient. And now we're kind of getting the word out, and we're able to just say, hey, did they qualify for any services? Because we're not experts in that kind of care, but we can call and be an advocate for the patient to try to get their resources expanded. Sometimes home health care is like oh, I didn't even know y'all were coming out every night. So that saves resources on wear and tear on the trucks, on the crews just responding. And really, that's not the ultimate fix for the individuals. So we're trying to get them to a better fix.
Yeah, and you're building a relationship with them. You're helping them build a relationship with other providers or resources in the community so that next time if they need something, they're not calling 911. They're calling the resource that they've been put in touch with, the community that they're building.
Correct.
To better serve their needs, really.
And the communication piece, like what she was saying, the nursing, perhaps the home health didn't know that they were utilizing our service on top of their service. And so just the communication piece has been a big change.
It really seems like coordination to me, kind of case management, just like stepping in and helping that individual build it. You're not creating the resources necessarily, but you're helping connect them.
You're right.
What we figured out is that paramedics are in the home every day, and we start seeing an individual, especially someone that we go on all the time or often. When we go and then we develop that relationship, we know them. So if they start to decline, we can see if they're having a decline earlier than the hospital or our doctor's office who's removed from that home environment. And so we can just see things in their home, and home health can do that as well. But when we're going there, say it's someone that's not receiving home health services, we're seeing a decline. And if we can connect them to services before they continue to decline, maybe we can stabilize them or have a better living environment for them sometimes individuals go through sickness or whatever, and they need like rehab because they need to get stronger so that they can maintain at home. And so we can identify that with the doctors and help them give them outside information that we're seeing in the home, and hopefully get them in services.
Yeah, so community paramedics would really touch a whole lot of different populations, potentially anybody, in Longview that would have need for care or emergency services. I do want to talk a little bit, or primarily, about how community paramedics would interact with homeless individuals or individuals with mental health issues, and how that would combine and work with our post officers at Longview PD. Give me an example or a time that maybe an individual, through your work, you helped either a homeless individual, or what would that look like? So if it wasn't a senior that was needing additional care or connection to resources, what does that look like in the mental health or homelessness area?
I would say that just to start off is when someone's in crisis.
Yeah.
And so that's when we get involved. So PD goes out there and they assess the patient and they see that they need an ambulance or need to go to the hospital. We are able to intervene as the community health paramedic and direct them in the right direction with our relationships with some of our partners, because that's their specialty. Okay. And so we refer them to their specialty, and instead of possibly take them to the ER.
Right,
or
that would be the other choice.
Right. Okay. That's the other
Mm-hmm.
choice. And so that's just one example that I can think of.
But you're responding, and then you're giving them a better resource, a better connection to immediately go to, as opposed to going to the emergency room, or even sometimes jail, I suppose.
In cases.
Yeah.
Yes, ma'am, in
Yeah.
certain cases.
So the emergency room has a process, and whenever you go to the emergency room, say you need counseling and you're calling 911 for services, that is not really the correct avenue to get to those services. It's more for crisis. ERs, just like it is for trauma care and things like that, that's what the ER is for. And for obviously, if you're in a mental health crisis, you do need to go to the ER. But if you're a low acuity mental health crisis, or you just need a connection to mental health services, maybe you have a funding issue, maybe you just you've called, but it's going to be a long time before you get in with the doctor, and you need more acute, quicker care, then we work with our partners to see if we can accelerate that for you. And
An
it's
example
only,
of that. How would you do that? What does that mean?
So we would go out with our crisis team. We have the post officer, we have the community paramedic, and then we have a crisis screener from Community Health Corps, who is our mental health authority. They respond to the scene together. This is the new program of the Mobile Integrated Health. They respond to the scene together, and they get the crisis screening at their home and determine what level of acuity the patient is, so we can determine where do they need to go. If they're not homicidal or suicidal, but they just need some mental health support, we can get them in with those services without going through the trauma of going to the ER, sitting in the ER, and waiting for a long period of time. When you go to the ER for mental health services, it takes a bit of time for them to get you there. With this, we're trying to do it outside the ER. That leaves beds freed up in the ER for other types of services. And it's more comfortable for the patient, right? Because they're at home or wherever they live, and we can just walk them through the choices, start making those phone calls with partners, and setting up a plan for them.
How is that call coming in? That's still a 911 call coming in from the individual in a mental health crisis?
Yes.
Okay, but now there is a team that's responding, that's community paramedics, you guys, that's our post officers with LPD, and that is a mental health provider.
Correct.
Wow, that's really
Yeah.
great. Tell me when that started and when we're running that and what the future of that is.
We just started in December of 2024, and we are doing that on Wednesdays, and we only work 8 to 5, so we're only a daytime possibility. We are tracking our nighttime calls that might fit into this category, just so we can show how we can be effective if we were 24 hours. So we're really just tracking our data. I'm trying to think of the number of calls we've been on. Do you know the latest number of calls?
It's upwards of 60.
Yes, about 60 calls
Okay.
we've been on and
So
been able to
one day a
navigate.
week, we're utilizing that, and we've done that
Yes.
for basically just this year. And we've been out on 60 calls with that multidisciplinary team. What'd you call it?
Yes.
An integrative?
It's a mobile multidisciplinary team, mobile integrated response.
Okay.
We're trying to come up with a really cool name for it, but that's the generic name.
Yeah. Are there any specific calls that you can think of that had a good outcome or a success story, or that, was that you were able to serve that person much better than what would have normally happened?
I think one of the best calls is we had a 30-minute turnaround time in the ER. Of course, if someone's sick and they have other medical conditions, that could keep them in the ER longer, because that's what medical clearance is to make sure there's no underlying medical issues. But when someone needs to go to a facility, mental health facility, they have to go to the ER for medical clearance. And so what we're trying to do is prearrange where they're going and all their details, get their paperwork gathered up, all the things the ER has to do while you're sitting in the bed. We're trying to do that, pre-do it and get it prearranged. And then, of course, they go to the ER for medical clearance. And both our hospitals are willing to develop new procedures for this particular model, where we would try to get the individual placed quicker.
Yeah. And I think, go ahead.
And that's on the mental health side. Also, substance use.
Yes.
We've been able to place several people in substance use facilities.
Okay.
That's
quicker and
without
more
going
efficient.
to the ER.
Okay,
Yeah.
so that team would respond there as well. Okay.
Yeah. So substance abuse, if they want to go to a facility, post and or community paramedic can work with them for that advocate piece to get them connected to services.
Okay, yeah, and I understand Pulsar would be a good information sharing where the patient's information can go between the hospital and just help speed up that process. I know it was like a 2-year process to get all of that on board. So just doing that groundwork and having that in place allows you to coordinate much faster, it sounds like.
I would just like to interject on the mental health services. That's one of our barriers just in the United States and in our state, is we don't have enough facilities for individuals that need that kind of care. So there is a delay in just having a place to go. But we are working with all the facilities in our area and have good working relationships to help facilitate that. But again, it's still bed dependent.
Need.
Yeah, and that's the benefit of the team, is that you have your law enforcement there, you have your paramedic with the medical, and then you have your mental health. So depending on what avenue that this patient is in crisis in, we're able to direct them in that avenue instead of making those phone calls or delivering time-wise. Communication
Yeah.
is helping, and then patient advocacy.
Yeah.
And some of these people have that layered effect. They need all three of those disciplines to work on their case, and it helps if we're doing it at the same time. Because we don't have access to law enforcement information, we don't have access to mental health information, but if we're all there collaborating together, we can speed up the process.
We talked about that some with Post, just that a lot of times if you are helping someone get into substance abuse, that might be not, that's not necessarily local. That might be in our greater region of resources. So you do, expand your network. And so the more you collaborate, the more resources you have to help place that individual and get them the services they need. So, yeah, that's really wonderful. Tell me about the prescriptions, and sometimes I know that is a prohibitor for placement in shelters, so people that have prescription needs. Talk to me about how you play a part in that.
Go ahead.
Well, so funding is a big deal. We did receive a Rotary grant originally that was funding that and has been funding that. Those funds are going down, and so we're going to seek for more funding to cover that. We only are a temporary fix. We don't do sustainable medications. All we're doing is assisting with medications to get them from this crisis to a stabilization point. So if you're going into a facility, or maybe you're staying in one of our shelters, they need some medications on board, especially if it's like mental health or even substance abuse type medications. They need those on board so that, because they are housing a bunch of people. Right. So we need to help people be stable so they can stay in those environments. So we'll get them like a 30-day script for their medications if they're out, or help them get what they need for the placement criteria of whoever is taking the individual.
Okay, yeah, so, because I understand it to be kind of a barrier, right, to the next step. So with Post, we talked about the homeless ID being, a very important basic step. Seems like prescriptions kind of is as well, because you can't really move to the next step unless you have that medical need cared for. So is that individual coming to you through a 911 call where you respond and their prescriptions aren't filled, or they don't have one, or is that maybe out of jail, or how are they coming to you? How's that patient coming to you? Does that question make sense?
Yeah, but I mean, that every one of them that you mentioned
yes.
there is true.
Okay.
Yes,
Yeah.
I mean we've had them come from all those that you just mentioned, and some people just realize, hey, I need some help, and they don't have those prescriptions that will get them into the places that they need. And so we just try to come in and fill that area. We try what we attempt to do is utilize what the patient's already using.
Right.
And just make those conversations with the people that they're already using. If they don't have anything, then that's where we utilize our partners and try to
Help speed up the process a little bit? Yeah.
Maybe they've missed their last doctor's appointment and they need a refill, and they haven't been to the doctor, and they need to reestablish with the doctor. Glow can help them reestablish with that doctor here locally and get seen, because we don't write the prescriptions, the doctors do. So that's where our partners come in. They see the patient, write the prescriptions they need so that they can go to the facility or connect to other resources.
Okay, so maybe first step, advocate for them with what resources they're currently using. Second step, connect them with the resources that you've kind of combined so that if they need additional resources. Yeah, and then transportation is also a barrier, right? And you miss, talking about missing a doctor's appointment. Tell me how that is addressed, or how you guys help with that if you do.
And so kind of the same way, we're just a patchwork, until we will take individuals to their appointments, doctor's appointments initially, to get them on a straighter path. And once that is established, we work with the facilities that we're carrying them to see if they can provide that transportation or figure out another means to get them there.
Mm-hmm. Tell me, as a community paramedic, what does your day look like? What are you doing?
Like I said earlier, we have a caseload. We have certain patients that we go check on, and we would go see, make sure their needs are met, make sure that they're not needing emergency services for anything, make sure they're making their appointments, make sure that basically that all their needs are met, and that there's not anything that's stressing the situation or making them anxious about anything to call 911 or use emergency services, and that we are able to fill that void for them.
And then how are you helping them? Are you getting on the phone and setting up appointments and advocating for those prescriptions and transporting them? Like, what does that look like?
Yes,
How much?
ma'am.
Yeah.
I mean, we do have appointments that are set up for medical, mental health. We have taken patients to get groceries. I mean, we have done all types of things to help them. And so that's in the day too.
Yeah, so you're building a relationship with them, learning what their need really is, but then you are yourself connecting those resources
Yes, ma'am.
for them,
Yes,
spending
ma'am.
the time to do that.
Figure out what their needs are, and then figure out who we need to bring in to fill that void.
Okay.
Once they're established with the service, they generally, like Medicaid has a transport service. It just takes time to get in.
Yep.
So once they're established and we know where their appointments are, we can get them set up, help them do that paperwork, and get a more long-term solution. We're not a long-term solution. We're
Right.
just a quick fix to keep them from going to the ER because it's not the right place for them. And then to really just get them in primary care. We do follow up with them, and once we get a plan, we work through a plan, assessment plan with the patient, and get a plan together for them on what resources they may need. And then if they're agreeable to those, we start connecting them. Then for the first few weeks, we'll follow up, make sure they're making those initial appointments, follow up with partners, making sure they're showing up. If they need transportation, say they're staying at a shelter, we would call them and say, hey, you have an appointment today. Do you have a ride situation covered? Who's taking you? Just kind of talk them through that. Maybe call the shelter and follow up. And then once we're sure they're going to make it, then we'll continue to follow up once they are stabilized in the services that they're connected to, and make sure everything's going the way we plan, and then that would pretty much how a case.
I want to say graduate, but it kind of, you're kind of a stopgap. So you're a coordinated entry, connection of resources, but then someone else is really going to, follow the plan through. You're not there long term.
And coaching them through the navigating the medical system. I mean, that's a lot of it. Navigating the clients through the system has been a lot of what we do.
Yeah, tell me how that works with some of those partners. So if they're GLOW partners or other nonprofit partners, what does that look like in your coordination with them? You're picking up the phone and saying, hey, I've got this going on. What does that look like?
Using Pulsera initially, because the Pulsera is where we put the consent. The patient has to sign a consent to allow us to communicate about their case. So through Pulsera, we can take a picture of that consent form, take a picture of their ID, get their, maybe we need some medication list, whatever that looks like. And then whichever partnering agency, say, we'll just use Wellness Point, for example. If they're a Wellness Point patient, that's where their doctor is, we can send that over to Wellness Point from the scene in real time, and then they can see they're consented. They can start pulling their paperwork, and then they can walk through, well, they haven't seen the doctor in this amount of time. We need to get them back in with the doctor, or whatever the case is on their, it could be their insurance issue or whatever. They can start working on that prior to the doctor's appointment. Okay. We don't rush appointments if they're not needed. So if it's just someone that they're stable and their medical is stable, but they just need to get back in with services, then we just do the regular appointment process like everyone else. But if they're in a moment of, if they don't get services, they're going to go to the ER, or they could have an issue, then those are the ones we try to speed up through the process to help keep them stabilized.
Yeah. Tell me, are there any success stories that come to mind that you want to share, or anything that, you're just really proud that the community paramedic program has been able to tackle?
One story that I like to share is a female patient that was housed, and she was elderly, living at home. She was a double amputee. She was a diabetic patient, and she lived with a special needs son who took care of her. She was living in a flat twin bed, no medical services, didn't really have chucks or any kind of depends or any kind of extra things she might need. And our crews were going out on her often because she would need to either get food or she was not clean, and she would get sick from that, and so she would have to go to the ER. And it just was kind of a revolving door. And when we started this program, we got with her and we were able to connect her with a palliative care agency who came in and was able to provide a bath a week, a hospital bed, the proper equipment to sit up and eat properly in bed, all the things that I just described that she might need. And so we were also able to get the son in with a partnering agency, get him some new glasses, and get his medical needs taken care of as well. And they just had a better quality of life. And all of that was already covered under Medicare and Medicaid. They had the insurance. They just didn't know how to. And our paramedics, they don't do that follow-up. So our regular paramedics are just constantly going out there, taking them to the ERs. And it's not till we really sit down with someone and go, why is this happening? And then realizing that they just didn't know how to connect to services. And we connected them to Meals on Wheels and also the food bank so they could get a food box. And so all that was just taking a moment to look at the whole person and seeing what is needed in the home.
Yeah.
And just
I really want to
working
thank
through
you
it.
and celebrate your heart for that, right? So your job is to respond and address the emergency. That's your 9 to 5, it's probably not 9 to 5 shift, but that's your 9 to 5 job, right? That's all you are required to do. And it is so important. And I'm so proud of all of the City of Longview employees that have a heart that see, hey, if I did this extra thing and I solved this problem for them and I treated them as a whole individual, this could be so much better for not just them as an individual, but for the system as a whole. And that's really what Community Paramedics does. Yeah, talk to me about what your heart is. Why do you serve there? What drives you to do that? Because that is extra. That's investing in individuals. That's learning about them for better or for worse. You know, what drives you individually to do that?
Well, we all need a hand up sometimes, right? We all need help every once in a while. Everybody does. And so it takes friends, family, community to get through things in your life. And sometimes you don't know when you're going to go through something difficult. And even if you know the system, when your family's in crisis, when you're having an issue, it's hard to think clearly and know because you're in a crisis moment. And so if we can look at individuals as they're in a crisis moment, how can we help them out of it? And they have to do work too. So we do the work together, but everybody needs someone to come alongside them. And I think that we've all experienced that in some form or fashion in our lives. And I think that's just keeping that heart in the forefront and realizing that I'm not here just to save a life, maybe make a life better.
Yep,
So
absolutely. Ricky, I'm going to make you answer this one too.
Yeah, and I mean, and back to what she said about that the paramedics just go pick them up and take them to the hospital. It's not that the paramedics in the field don't want to help.
Yeah.
That's just the system.
Right.
Yeah.
That's the system that they're working in. And we're trying to open that system up to where it's a different way of looking at it and doing things differently to be more efficient with dollars and with the patients and care and be more proactive. I don't know how to answer that question, honestly. It's just
caring for people.
Yeah,
And Ricky
yeah.
does that well, and he's a good example of that in our community. And I think that's why people respond to him well in the field, is because he cares. I'll brag on him for everybody else. But that's why it's important. And it takes a different kind of individual to do what we're doing. And back to the paramedics, they now have a resource they can refer to us. So before, when we were in the field on an ambulance, we didn't have a resource except for to go to the hospital and say, hey, they need this or that. And then the hospital would be like, okay, what do we do with that? So because that's not their primary job. And so having a way, and it's changed. Our industry is changing. The nursing students work with us and shadow all our nursing schools here locally, and that helps because we want new people getting into this business to think bigger than just the moment. Right. Think about the whole person, not just what you're seeing. And so,
and if you do see that same person 10 times, why? Ask why. What's going on with it that we can help you with? Because if you're coming here for 10 times, then possibly you're not getting what you need.
Yep.
Let's see if we can figure out what you need and let's do it different.
Yep. Absolutely.
So.
What would you want the community to know about community paramedics?
Oh, you're a community paramedic.
Well, we've said most of it,
Yeah,
but
it's just a different way of doing stuff.
it's thinking out of the box, coming up with another solution. I would say this is time consuming. When we work with an individual in a day, a community paramedic could be
Seems
initially
very
4
individualized,
hours
very
with
time
somebody.
intensive. Yep.
Yeah, because you're really working through kind of a crisis moment to figure out what's the needs are. So it's a slow process. It's nothing fast. And some of these take time to work through all the layers of things somebody might need. I think we're seeing it all over our country that non-medical drivers are of health, which is food, transportation, connecting to resources. That's just a challenge. It's so kind of ironic, even in a Google age where we can look something on our phones, not everyone has the skill set to do that. Yeah. And so if they don't and they can't get the resources, they will call 911. And we see that every day. And so this is a different way. And when I say 911, I mean police and fire and EMS, all of us. And so we've got to find a way to help people connect better so that they can get the
Give them
right
a better
resource.
option, because when you're calling 911, you don't know what else to do.
Yeah.
How do we give them a better option?
Yeah.
And that's a system that's built to do specific things that may not fit what their needs are.
Yeah.
Right, right. What's the future of community paramedics in Longview? What do you need? What's the future goals? What does that look like in 5-10 years?
Staff.
That's two people's answer too. People.
Yeah.
That,
More
yeah,
people.
that's hers. Mine
Yep.
is that I don't have a job.
Yeah.
Wouldn't that be
So,
wonderful?
yes.
Yeah.
Yep.
Yeah.
That's my goal, is that
Yeah.
I don't have a job.
Yep.
That the system is working the way it's supposed to.
Love people so well, you work yourself out of a
Yes,
job.
ma'am.
Yep. I like it. Good. Well, thank you guys so much. I am so proud that Longview has this program. I'm proud of the heart that developed it. I'm proud that we do it. I think it's just incredible. And thank you for loving and serving so well.
Yes, ma'am.
Thank you so much for joining us here today to learn about our community paramedic program here in Longview and the Greater Longview Optimal Wellness program. We're so proud to have these things here in Longview, and it's due to the heart of our City of Longview employees and all that they care for in our community. So thank you so much, and we'll see you next time.